Hello everyone, this is Dr. Pradeep Dubey and you are watching DIMS Ophthalmology, where you learn everything just by imagination. Now I am starting here another section of retina OSCE and Viva questions. In the first question, fundus photograph is given. Now listen carefully. After seeing the photograph, you should quickly go through all the questions given in that OSCE. In this OSCE, the first question is what is the diagnosis and second one is the ETDRS definition of CSMA. Here we got a clue that this photograph must be related to the clinically significant macular edema. So we can appreciate here that this leaking microaneurysm, which is surrounded by a circinate ring of hard exudates, makes a probable diagnosis of focal diabetic macular edema. Now the next question is the ETDRS definition of CSMA. We can understand it by visualizing these three fundus photographs. First criteria in the definition of CSMA is the presence of retinal thickening within 500 micron from the center of the macula. Second is the hard exudates present within 500 micron from the center of the macula if it is associated with the retinal thickening. Third criteria is the retinal thickening of 1500 micron or larger and any part of which is within 1500 micron or one disc area from the center of the macula. So here we can make a concept that all three criteria have retinal thickening. In the second criteria, along with retinal thickening, there are also some hard exudates that are present. In the third criteria, the retinal thickening is more, which is around 1500 micron or one disc area. Now the third and fourth question is on the management of DME and studies of anti-VEGF and steroid implant for diabetic macular edema. There are three options in the management of diabetic macular edema: focal laser, intravitreal steroid like intravitreal triamcinolone and dexamethasone, and we can also use anti-VEGF like ranibizumab and aflibercept. Now studies of anti-VEGF for center involving diabetic macular edema. First is DRCR.net protocol I, which concluded that ranibizumab is more beneficial than focal or grid laser. Second is DRCR.net protocol T. According to this study, in a case of diabetic maculopathy, if visual acuity is better than 6/15, then anti-VEGF like bevacizumab, ranibizumab and aflibercept all three have equal efficacy. But if visual acuity is worse than 6/15, then aflibercept is superior to bevacizumab. Studies for intravitreal steroid implant are Vivodex study for dexamethasone implant and FAME study is for fluocinolone implant. Now the Viva section for diabetic macular edema. It is frequently asked that in DME, fluid accumulation occurs between which layers? Basically, it accumulates between outer plexiform and inner nuclear layer. Second Viva question is how to differentiate diabetic macular edema from Irving-Gass syndrome. It is differentiated by fundus fluorescein angiography. In Irving-Gass syndrome, leakage of fluorescein have specialized petalloid appearance, while diabetic macular edema have diffuse leakage. Disc staining present in diabetic macular edema, while it is absent in Irving-Gass syndrome. Next Viva question is what are the FFA and OCT classification of diabetic macular edema? On FFA, it is classified as focal DME, which we have already discussed that there is leaking microaneurysm surrounded by a circinate ring of hard exudates, and there is focal area of hyperfluorescence due to leakage from corresponding microaneurysm seen in late phase of fundus fluorescein angiography. Second is diffuse DME, in which there is diffuse retinal thickening present, which may render localization of fovea impossible, and it shows extensive hyperfluorescence in late phase of fundus fluorescein angiography. Third is ischemic maculopathy, in which there may be the large capillary non-perfusion areas and irregular or enlarged foveal avascular zone is seen in fundus fluorescein angiography. Second part of the question is OCT classification of diabetic macular edema. On OCT, it is classified into 5 stages. Stage 1 is spongiform, in which there is diffuse retinal thickening. Second stage is the cystoid macular edema, then vitreomacular traction, sensory series detachment and tractional retinal detachment. Next frequently asked Viva question is prognostic marker of DME on OCT. There are 2 positive and 3 negative biomarkers of diabetic macular edema. Positive markers are subretinal fluid, intraretinal cyst and edema, while negative markers are hyperreflective foci, disorganization of retinal inner layers, and integrity of ISOS junction of photoreceptors. Thanks for watching this video. See you in the next video.